welcome back at 3 and Eye on Health right now. The Centers for Disease Control and Prevention estimates that 1 in every 1,600 babies are born with a cleft lip or cleft palate. And this month, the surgeons at St. Mary's Medical Center, the Children's Hospital there, are starting a program to help those access this important procedure. And here to tell us all about it, we have Dr. Edward Davidson joining us now. He's the chief of plastic surgery over at the Children's Hospital near St. Mary's. And thank you so much for being here. For those who don't know, let's begin with that. What is cleft lip and cleft palate?
Yeah, so cleft lip is one of the most common congenital anomalies or differences where patients are born and during their development, their lip doesn't completely close. So you see that characteristic sort of gap in the upper lip, and it can be associated with a cleft or a gap that goes into the roof of the mouth or the palate. And that can create, the cleft lip itself is mostly an appearance-related issue, but cleft palate can create an issue with speech development as well.
I imagine what that's like. Before we get into the treatment programs and the post-surgery and why it's so important to follow up, let's talk about why, even though this is a rare birth defect, you're doing something about it here. Tell us a little bit about the program.
Right. So, I mean, we're extremely proud of the cleft care that we provide at Palm Beach Children's Hospital, but the nice thing about having a dedicated, what we call multidisciplinary clinic is for patients and families who need regular appointments, at least annually. You know, it can be a host of different treatments along the cleft journey from infancy through to adolescence, and even prenatally we meet with families and counsel them. But that can be a lot of hospital visits. It's obviously can create logistical difficulties for families. And the nice thing about having what we call a multidisciplinary cleft team clinic is that patients and families can come and meet all the providers that they need at one setting. So that's the cleft craniofacial surgeon, it can be a pediatric ENT, audiology, speech language therapy, social work, pediatric dentist, orthodontist, all the team are there in a dedicated clinic to seeing those patients and their families at once.
So you just talked about a little bit of some of that, of the treatments that you offer, but it's also really important, and I feel, especially for children, that post-surgery follow-up, right? Because I think that has to do with speech development. Talk to us about that and the recovery process and following up.
You know, cleft care is really not an event, it's a process, and like I said, that begins even before birth, meeting families for prenatal counseling, and they can have, require some surgeries in infancy, some surgeries in adolescence, and sometimes patients that have a cleft lip and palate may have a lip repair, then a palate repair, then they may need another operation to help improve their speech, then they may need a surgery on their gum, they may need some jaw surgery, and then surgery on their nose. So it can be multiple surgeries going from, you know, early infancy at 3 to 6 months of age, right through till 18 years of age. So really, that whole cleft journey can be quite
it's a lot of work, and a lot of follow-up, a lot of things to do. So that's why it's so great to know that you guys have this program at the Palm Beach Children's Hospital at St. Mary's. Is there anything else you want to share to our viewers?
Well, I think as well as, you know, I think probably the viewers are mostly aware of cleft and what that looks like, but the clinic also addresses other craniofacial differences. So that might be congenital differences of how the skull grows or how the facial bones grow, and sometimes that goes hand in hand with clefts as well. So we treat all of those conditions too.
All right, the plastic surgery chief at the Palm Beach Children's Hospital, very close to St. Mary's Medical Center in West Palm Beach. Thank you so much for joining us, and we'll be right back.